let's go ahead and get started. So what are we talking about today? We are talking about a condition or a situation or a syndrome that so many women suffer from, not enough women talk about. We, as women going through midlife, so perimenopause and menopause, we don't talk about that enough. Like that doesn't get enough press. There's only 1% of medical research that goes towards the dollars spent on medical research that goes towards women's health. And a tiny fraction of that goes towards perimenopausal or menopausal health. It really is disregarded. So doctors don't know about it. Women don't know about it. We're shocked and surprised. And we're like, what the heck is happening to our body? We know about the hot flashes. We know about the night sweats. We know about the weight gain. And most of us know about bone loss and osteoporosis, but there's like 90 other symptoms that are going on. And one of the major ones that happens to nearly every woman, it's between 86 and 89% of women will experience vaginal dryness. That vaginal dryness term is kind of not the right term because it's not just vaginal dryness. It's a whole syndrome that deals with the vagina, but also the vulva, the entire area between your legs. So a lot of people call what you see when you look or what your partner sees the vagina, but that's actually your vulva. The vulva includes the mons pubis, which is that kind of that plush little fatty area kind of under pubic bone, then the clitoris, then you have your labia, your inner and outer labia, the labia majora and minora, and then you have your urethra, which is the opening to your urinary canal. So it goes to your urinary tract and your bladder. Then you have the vaginal opening. Your vagina is the canal that leads up to your womb or your cervix. So that your vagina, that's actually your vagina is the tube. So the vaginal opening is there. And then you have the perineum, which is the area of muscle tissue between the vagina and the anus. And then you have the anus. And the whole pelvic floor is that bowl of muscles, that sling that kind of holds everything in place. And so when we say vaginal dryness, or really the term that we used to use a lot in medicine was vulvovaginal atrophy, or VA. And that includes all of the changes, those tissues down there. But now the term that's becoming more popular is genitourinary syndrome of menopause. Now it's a mouthful, so we abbreviate it GSM. So genito means your genitals. Urinary, that's your urinary tract. Syndrome of menopause, because that's generally when it happens. But you don't have to be in menopause to have the vaginal dryness, the pain, the atrophy, the irritation, burning. All of those things can happen anytime you have a loss of estrogen or a loss of circulation to the area. So we see this in women who have had chemotherapy. We see this in women who do extended breastfeeding. When you breastfeed for a year or more, your estrogen drops to menopausal levels. Now, the good news is as soon as you stop breastfeeding, it will return. So it's definitely not a bad thing. But some women will start to notice some dryness, some discomfort. And so it's, a lot of women don't realize that this is a side effect. The good news is that if it's happening due to any drugs that you're taking, if it's happening due to breastfeeding, that will return to its normal state once your hormones get back into balance. With perimenopause and menopause, like I said, we all know about the hot flashes and the night sweats and the weight gain and all the other symptoms that we think about. And those, many of them, women will experience for 5 years, 7 years, 10 years, and sometimes you can get through it on the other side. Usually when women are in their 50s and 60s, they're having the hot flashes, and I would say about 60%, sometimes more than that. By the time they get to 70, their hot flashes are mostly done. We do have many women who still experience them even after that age if they're not doing anything to treat it. So there is relief at the other end for many of the symptoms. With vaginal vulval symptoms, there's no going back if you don't treat the problem. So this is a really big concern. And when I'm talking about some of the symptoms, what we're looking at dryness, So lack of moisture to the area, but then we're also talking about itching, burning, either just itching and burning normally or itching and burning when you try to go to the bathroom to urinate, pain with intercourse because the plush, soft tissues that used to be like a little padded mattress are now paper thin, and the cells are not getting plumped up by the estrogen anymore. They're not having that protective barrier anymore, so they're more likely to get irritated. Loss of elasticity. So our vaginal and vulval tissues, they're very elastic, they're stretchy, and that stretchiness comes from the collagen and elastin that is provided by the estrogen that's saturated in those tissues. Now, when the estrogen goes away, the elasticity goes away, the tissues kind of shrink. You'll actually have a shrinkage of the tissues, and they will kind of deflate, and they'll be less plush and less stretchy. And this can be a problem, of course, for intercourse, but also when you walk, when you go to like stretch, if you are going to exercise. And so many women don't feel comfortable exercising. They do less physical activity because they're just not comfortable doing it. A lot of women will tell me when they come into my office or when we meet with them virtually that they're having trouble even wearing underwear. And it's really uncomfortable for so many women to get dressed, to wear pants, to ride a bike. And quality of life can really be diminished. And that's not all. That's not the only problem. Is also, we have the urinary symptoms. So we can have frequent and chronic urinary tract infections, which is a problem because that's going to require the administration then of antibiotics. And then chronic antibiotic use, that can cause issues with gut health, all these other things. And if you do have a chronic infection, anytime you have an infection, it's not good. And there's always a chance that it can seep out to other areas and you can end up with sepsis or a really severe condition that is rare, but we don't want chronic urinary tract infections. One, because it's no fun. And then two, it's just not healthy for you. And then also we see with the changes in the pH because of the environmental change of the whole vaginal vulval area due to the loss of estrogen, we'll see the occurrence of yeast and candida, incontinence due to the lack of integrity of the tissues. So the pelvic floor is not as strong because estrogen is really, it's so important for the contraction of the muscles. And so if you can't really get that strong contraction, then that pelvic floor cannot hold the vaginal tissues in place. And so that causes that incontinence and lots of other issues down the road. Of course, sexual dysfunction, painful sex, not wanting to have sex, all of those things cause quality of life issues. Women are not happy. And the problem is they're not talking about it. A lot of women either are too embarrassed to talk to their doctor about the situation due to like social norms, and even like saying the word vagina is like taboo for some reason, even though it's an anatomical body part. There's absolutely nothing wrong. It's not a bad word, but we have, of course, like people getting nervous or they've just been brought up not to talk about it. Also, the idea of going into the doctor and having him examine you down there. A lot of women don't want to have anything to do with it, or they're just kind of diminished when they do talk about it to their doctor, like, oh, well, that's just what it's like to get older. And many doctors don't have any solutions. So there's kind of like a few different things, but I will tell you that even in meeting with women in our Healthy Hormone Club and in talking to all my hormone specialists, there is an ongoing theme where we ask women about their vaginal vulval symptoms, and they're like, no, it's fine. But then we'll press and we'll be like, well, you know, most people, almost 90% of women have these issues. So are you sure that you don't want some treatment for it? And then they'll be like, well, okay, you know, you can give it to me. There's just some stigma about talking about it. And so that's one of the reasons why I'm making this video, just to make it more normal, to explain what the options are. And so there are a lot of options when it comes to treating. Oh, the other thing I need to talk about is there's changes to the way the vulva looks and the way it smells. There's sometimes some sagging. Now there's all shapes and sizes to vaginal and vulval tissues. The labia in some women are longer or shorter, plumper or thinner, and there's no wrong or bad shape or size to a vulva or vagina. However, if you notice yours is changing or different somehow, it feels a little weird when you get dressed, and you're at the age of 40 and over, that's a good sign that you have GSM or genitourinary symptom of menopause. It's not always dryness. It's not always painful sex. Sometimes it's one or two or more of these symptoms. Most of the time, for many women, it is a lot of them rolled into one. And so that's an issue. And then, of course, incontinence. So when you pee, you might pee a little when you sneeze or when you laugh or if you jump up and down. This is common if you just had a baby because your pelvic floor has gotten stretched out, and that's pretty normal. But if you haven't just had a baby in the last year and you're at the age of perimenopause and menopause, the incontinence or the really feeling urge to pee or like something's feeling heavy down there, that's also a sign of that loss of estrogen. Really important to treat this because it will only get worse. Now, there's a few different ways that you can treat this. Number one, the easiest way is you can definitely use a non-hormonal moisturizer. You can use lubricant before intercourse. So you can use a vaginal lubricant. You can use, and I totally recommend that anytime women over 40 are having sexual intercourse, use a lubricant. It's going to be much more enjoyable, much more fun. It's not saying anything negative about you or your attraction to your partner. There's no judgment on it at all. It just makes everything more pleasurable for both partners. So definitely reach for that lubricant. But at the very least, a non-hormonal vaginal moisturizer can be helpful for some women just to moisturize the tissues. Now, there's a lot of them on the market, and some of them are good and some of them are very bad. If they're filled with chemicals, things you can't pronounce, some of them aren't the right pH. So a vaginal pH should be between about 3.8 to 4.5. That's optimal. If you're outside of optimal, if it's too high or too low, it can cause issues like bacterial vaginosis. It can cause other bacterial infections, overgrowth, yeast, cottage cheese like discharge, all the kind of stuff you don't want, more itching, more burning, more problems. So we want to make sure that it's pH balanced and doesn't have any fragrances, doesn't have any strange chemicals, because that's just going to make things worse. And for some women, this can be helpful, but for many women, this is not enough because it's not treating the root cause of the issue, which is the loss of estrogen. Our vaginal and vulval tissues absolutely need estrogen in order to have that elasticity, to have that tissue integrity, for the cells to be plump, to have that barrier wall, to have the moisture. And so for them to truly function properly, then the estrogen is really needed. And the wonderful news is that there are many low dose topical bioidentical estrogen products that you can either get prescribed from your gynecologist or your primary care physician or hormone specialist, or we have one that's actually over the counter. Now, this can be done because vaginal estrogen is only about 1/100th. The dose is very low dose. It's about 1/100th of what a woman would take like orally for her hormone replacement therapy. So hormone replacement therapy, bioidentical hormone replacement therapy, BHRT, very different from vaginal estrogen. Vaginal estrogen stays local to the vaginal tissues, and you use a very tiny dose. Topically, it absorbed right into the vaginal tissues, into the urinary tissues, right where you need it, and it doesn't go systemic. So you'll have pretty much zero change in your blood levels of estrogen. This has been studied, and it's been actually clinically proven that vaginal estrogen and a placebo had the same blood levels of estrogen change, which was nothing basically. And so it can be used in the morning when you wake up after a shower. It can be used before and after a workout. It can be used before intercourse, after intercourse. Vaginal estrogen is wonderful. It really restores that elasticity, and you can Our product is called Vulvo, so it's this here. You do not need a prescription, and it does have all of the hydrating non-hormonal ingredients like shea butter and almond oil and vitamin E and hyaluronic acid and all the things to lock in that moisture. And that gives you that immediate benefit, that immediate soothing. It has cocoa butter and beeswax. So if you have like lichen sclerosis or some really extreme irritation, it has that protection and that soothing aspect. So that immediate relief, that immediate moisture. However, it also has the low dose bioidentical estrogen for the long-term help, for the elasticity, for the muscle contraction, to help with the pelvic floor, for the reduction of UTIs. So for all those things, you really do need some estrogen. Now, if you do want to go the prescription route, there is the E-string, which is a little insert it's a little ring that you insert into your vagina and it stays there. And that's great for people who have like dementia or someone who can't remember to use their vaginal moisturizer. However, many times, even with that insert, the vulval tissues, the labia, all of the tissues surrounding, they still need some moisture. So you might still want to use a gel or a cream or a serum to help to moisturize that. And then is also little applicators with little tiny pellets. I forgot the brand name of that, just little estrogen pellets that they go and they sit inside the vagina and they kind of release. So those are options. And then for some women who also have the hot flashes or a bone loss or a brain fog or other symptoms of menopause, they might want to use both vaginal estrogen and then also hormone replacement therapy, preferably bioidentical, because that's going to kind of help in both ways. The vaginal estrogen is not going to do anything for things like hot flashes or bone loss or anything like that, because it does stay local to the vaginal and vulval tissues. However, systemic hormone therapy can help with the vaginal issues. It does take longer. It doesn't have that immediate relief, but about 20% of women still need that topical, local vaginal estrogen as well. And most women will still need those moisturizers. Think about like this. As we age, and even before we get older, we moisturize the skin on our face. Most women, now I don't know about you, but for me, every morning when I wash my face, every night when I wash my face, I follow it with a moisturizer or a serum to keep the elasticity so my skin doesn't get dry and tight and cracked. If I didn't do that, I would have like dry patches. My skin would probably crack. If I didn't put chapstick or lip balm on ever, I would have chapped lips. They might be dry and bleeding. They'd probably hurt. But we totally ignore our vagina. Like we're just like, oh, well, she could just do her own thing. And really, it's really just important to take care of the skin down there as well. And there's many ways to do it. Now, I talked about the Global, but it's actually not available for sale until Monday. We just got this in and we have very limited supply, but we actually have our order in for more. And I'll send a link with a replay to the page where you can learn more about it. It's very affordable and only has 8 ingredients: shea butter, sunflower oil, almond oil, cocoa butter, beeswax, vitamin E, hyaluronic acid, and then it has micronized estriol and micronized estradiol, both bioidentical. The amount is only 20 micrograms of estradiol, and there's 80 micrograms of estriol. So it's super low dose. You can put it on your husband. It won't change with estrogen at all. So it's totally safe for before sex, after sex. We also have a version with DHEA coming out as well. The estrogen does work better for the moisture and the elasticity. The DHEA is a little bit better for the sexual function, the sensitivity, although the estrogen works great for that too. And for those who have breast cancer or are breast cancer survivors, it's well established by oncologists, the American Medical Association, the North American Menopause Association. It's well established that vaginal estrogen is safe for those patients, low dose topical vaginal estrogen. So it's really great. So that's kind of my little overview on vaginal issues, what GSM is, or genitourinary syndrome of menopause. You're not alone if you face it. Like I said, 85 to 89% of women do experience these symptoms on some level. and only 7% get proper treatment for it. That means women all over are suffering. So if you ask your girlfriend to go on a bike ride and she says no, chances are because she cannot ride that bike. And there's so many women who are dealing with this. I talk to women every day who are really upset. It's ruining their relationships. It's ruining their confidence. It's preventing them from actually doing the things that they want to do. And so this is a serious issue. It needs to be talked about. Not all doctors understand it. A very small percentage of doctors do. So if you've been told there's nothing you can do, or it's just part of getting older, or I actually had a doctor tell one of my patients to take one for the team when she told her doctor that intercourse was painful and she was worried about her relationship. So I've heard all spectrums of things, from it's the price you pay for being a woman. This is just what it's like to get older. You're not a spring chicken anymore. I've heard all the things. None of them are acceptable except for here's a solution, or no one's acceptable from a doctor who doesn't have the answers. Is I am not an expert in that field. Let me find you someone who is, or let me refer you to another doctor, or I recommend that you see someone who is an expert in female hormones so that you can get some relief. That would be the right answer. So anyway, I'm going to open it up for some questions right now, and we will go from there. So we do have a lot of questions, so I will go ahead and answer some of these right now. Can you talk about bacteria, vaginitis, and solutions without antibiotics? So the root cause of bacterial vaginitis is due to imbalanced microbiome. Our vagina has a specific microbiome, as does our mouth, as does our skin, as does our gut. Many times when that area becomes dry, the environment changes. The organisms that used to be able to live there are not able to live there anymore. And then if the tissues get irritated, if the pH changes, then that can be an issue. Some of the causes are going to be things like douching, any feminine hygiene washes that are out there on the market, any perfumes or scented products to be put in the vulval or vaginal area, that can create a problem. Wearing like nylon thongs, wearing gym clothes or very tight pants that for a long period of time, or working out and then going grocery shopping after, even though your pants are sweaty or your underwear is sweaty, then that can kind of make that bacteria grow. Even after intercourse, with intercourse, semen is actually alkaline, and so it can actually throw off the pH of your vagina. So it's recommended to try to urinate after intercourse. And if you can't urinate, then at least like take just water on a washcloth or rinse and just rinse off. That way you won't have that change to the pH. Other things that can be issues is long-term antibiotic use, gut bacterial overgrowth that can move down through the bladder. Bladder infections can be a cause as well. Also, panty liners, sometimes they're scented feminine hygiene products like tampons. All of those things can be a root cause. And a lot of times it can just be if you have irritation in that area and you've lost that protective barrier, then that can put you more at risk. So definitely, like a product like Globalo can totally help. You may have to take a short-term course of antibiotics to get rid of the infection, and that's completely fine. I wouldn't not take them because you're worried about gut health or you're worried about something else, because that infection can get worse. But just follow that up with really good probiotics, prebiotics. All those things can really be helpful. And probiotics are super helpful for vaginal health, even if taken orally. Those can really help your microbiome. What you eat is important for your vaginal health as well. And also for vaginal dryness, like having omega-3 fatty acids, things like salmon, super awesome for your vaginal health. And a wide variety of fruits and vegetables, those have all the prebiotics and probiotics and different microorganisms in them, super important as well. So those can really help. Absent of receiving bioidentical hormones, how can we decrease or rid ourselves altogether of the menopause symptoms? Well, the root cause of the menopause symptoms is the loss of hormones. So if you do not want to take hormone replacement at all, you don't want to use vaginal estrogen that's local to the vagina, then you can do the non-hormonal hormonal moisturizers. Just make sure that they are completely clean, that they have clean ingredients. You can find ones. We're probably going to come out with a version of Glow Below that has no hormones in it. The reason why I didn't is because it doesn't work as well. I'm all about the root cause. So we wanted to provide the product that is going to actually solve the problem. And because it's so safe and there's no downside to the low dose bioidentical hormones, that's why we included it. But there are products out there. I believe there's a brand called Yes, YES, that is plant-based and mostly organic, and they have a vaginal moisturizer. So you can do something like that. And then as far as lifestyle is concerned, strength training, eating 1 gram of protein per pound of body weight, meditation, optimizing your diet, all those things can help with bone loss, can help with reducing risk of heart disease, can help with a lot of different issues. So there's things you could do. I actually have a book. This is my book, Hormone Harmony Over 35. There's no hormone replacement in here. It's all lifestyle. This is how to optimize your hormones naturally. I'm a naturopathic physician. I do offer hormone replacement in my Healthy Hormone Club because I feel like it's needed for, it's available, and it is the best way to optimize your hormones after perimenopause and menopause, but also do all the root cause stuff as well. Our program, the Glow Protocol, that is all a natural medicine implementation program, doesn't even cover any hormones. And so there are things you can definitely do. Do you always recommend DIM if on estrogen and postmenopausal? Do you always recommend DIM if on estrogen and progesterone cream for postmenopausal women? I usually do, because instead of taking a genetic test and looking to see how you're breaking down your hormones, and because of all of the other xenoestrogens in the environment, DIM will help you to process your estrogens better. And most of the estrogen exposure that we get is not from the bioidentical hormones that we're taking in or our own hormones. It's from cash register receipts and plastic bottles and the water supply and all of those things. So the DIM just helps with the detox process, and it helps to put all the estrogens down the more optimal pathway, and it helps you to kind of break down your estrogens a little bit safer, just in case. If you're already breaking them down the proper pathway, then it doesn't hurt. And the way we recommend DIM is in our Daily Glow supplement. So it's part of our multivitamin, multi-mineral, adaptogenic herb, and thyroid support formula. So you're not taking something extra, it's just in that formula. Awesome. Let's see. What are your thoughts on essential oils? I love them. You can see, can you see? Oh wait, that side up above. Those are all my essential oils. I'm a big fan. And herbal supplements to treat hot flushes. Thank you from Australia. Herbal supplements to treat hot flashes. Ashwagandha, adaptogenic herbs can be helpful because one of the root causes of hot flashes is stress. That can be super helpful. Also, avoiding triggers for hot flashes. We actually have a blog on our website that is all about hot flashes and hot flash triggers. And so you can go through and you can treat some of those, and you might find some relief from hot flashes. Omega-3 fatty acids and vitamin D are 2 things that have been clinically proven to help with hot flashes. There's other things like African rhubarb and black cohosh that have anecdotal evidence, but the clinical research doesn't really show they are any different than placebo. So it might be just the idea of taking an herb that you think is going to help your hot flashes might help your hot flashes, because there is a psychological component there, or on a subconscious level. We also have at Glow Natural Wellness, we have a wonderful meditation mindset manifestation expert. Her name is Jen, and she has created a self-hypnosis or subconscious activation for hot flashes, for insomnia, and for mood swings. And that is actually clinically proven to help with hot flashes. So there are things non-hormonal to help for sure. But the reason why estrogen does help with hot flashes is because when we lose estrogen, it causes the hippocampus, which is in our brain. It's where we control our temperature, that shrinks. And that causes the temperature regulation to be off. And so by replacing estrogen, that's treating the root cause, not the symptoms, but you can use herbs to treat the symptoms. So if that makes sense. but there's things you can do. Let's see. I'm 55. I no longer have a period and have hot flashes and vaginal dryness. What can I do to help that naturally? I would recommend for the vaginal dryness, you can do that immediately without a doctor's visit or anything. You can use, like I said, over the counter, like Glow Below has the low dose estrogen and all of the botanicals to help soothe. And then for the hot flashes, you can do bioidentical hormones. That would probably be beneficial. And the reason why is because not only do bioidentical hormone replacement want to help your hot flashes, but it also prevents heart disease, prevents osteoporosis, dementia, diabetes, extends life. And so those are the reasons why we promote bioidentical hormones. It's not just for the symptoms, it's for the extension of life, because women used to die 50, 55, and now we're staying alive much, much longer. But all the studies and all the research does show that all of the risk factors for chronic serious disease that leads to death does go up drastically when the estrogen depletes. The estrogen is kind of our life force. And so by replacing that, we can extend our life and reduce the need for pharmaceutical interventions, so reduce the need for statins and cholesterol medication, reduce the need for diabetes medication, reduce the need for osteoporosis medication. All those things can be pushed back or reduced or eliminated with the correct dose and delivery method of hormones. Topical bioidentical hormone replacement comes with almost zero risk, and it does help all of those problems. But if you're absolutely against it, adamantly against it for one reason or another, maybe you don't have all the information, or you have some type of you don't want to do it for any reason, there's other things you can do. Let's see, I'm 25 pounds underweight. I try to eat healthy and I cannot get over 100 pounds. What about collagen supplementation? That's probably not going to be enough. You probably really have to focus on the healthy fats, because that is going to get you more calories. I would work with a nutritionist to really help you make sure that you are getting what you need, seeing if there's an issue with your hunger hormones, if there's a reason why you're not hungry. Make sure that your gut microbiome is where it needs to be, so you're absorbing and assimilating your nutrients. But I would start with protein powders, making high calorie smoothies so you don't have a lot to chew. Put fruits and vegetables and healthy fats and nut butters and all that stuff into a smoothie, and you can get a high calorie, high nutrient density, high protein smoothie to help get your weight up. And most people don't have that problem, but it is a true problem to have as well. Let me know if that helps. Why don't you test estriol? What is the optimal ratio of estradiol to estriol? How many milligrams is there in each pump of your hormone creams? We have all that information on our website, so I'm not going to cover that right here. The reason why most people don't test estriol, including us, is because estriol is a very weak estrogen. It doesn't have a lot of activity other than just helping estradiol. Estradiol is the estrogen that does all the things, and our body makes estriol and estradiol in about an 80-20 ratio. So it's mostly estriol with a little bit of estradiol. And when we replace estrogen in our practice, we do 80-20 as well. Estriol is shown to be protective against cancer as well. And also is shown to help with dryness and skin plumping and elasticity, which is why the 80 milligrams in our Glow Below is the estriol, and the 20, micrograms, and the 20 micrograms is the estradiol. And so 1 milligram is 1,000 micrograms. So it's a very tiny amount. Let's see. My gynecologist told me that if I started bioidentical hormones again since I was 70, I have an increased risk of developing a blood clot. That's only if you're starting oral bioidentical hormones. At topical hormones, transdermal, a patch or a cream, does not go through your liver, does not create the clotting factors, and so there's no risk, no increased risk of blood clots with topical or transdermal bioidentical hormones. You can go back to your gynecologist and give her a little lesson, but a lot of the research or a lot of the papers that she might be reading, it's on oral hormones. All the studies that are linking estrogen or progesterone to strokes or clots are on oral, usually synthetic hormones. But even oral bioidentical hormones can create those clotting factors because they have to go through your digestive tract and go to your liver. The liver has to break down and metabolize that estrogen so it can then go to your tissues. And in that process, there's some clotting factors created, and that is the problem with the clots. Now, if you're doing a patch or a cream transdermally, that's getting into your bloodstream and going to your tissues, no clotting factors are being created. So there's no stress on your liver, and there's no risk of clots with topical hormone replacement, and preferably bioidentical as well. Do both estrogen and progesterone contribute to extreme breast tenderness and pain? Just started BHRT in November, and the breast pain is almost unbearable. Anytime you have changes to your hormones, so if you start hormone replacement therapy, then you can have some breast tenderness. The best thing to do for that is, one, I would say cut your dose in half just to let your body get used to it. Or if you're doing topical hormones or creams, then put them below your waist. So do the inner thigh or behind the knee, and that will reduce the amount of breast tenderness. But just pull back the dose. You may still have lower than optimal hormones when you do your retest, but just know that you're going to gradually reintroduce it. It's just like when you might have, if you've ever been pregnant or you ever were to when you first started getting your period, you'd have breast pain around your period because it's the changing hormones. You went from probably almost nothing to close to optimal, and that jump just might have been too much. Let's see, I've been in menopause for 19 years, been on estradiol patch, okay, with the doses for 16 or 17 years, still get hot flashes. Is it safe for me to continue on this? It is safe for you to continue on this. If you're still getting hot flashes, even with the dose that you're on, you might need a dose adjustment, or you might have to look for triggers, things like caffeine, chocolate, spicy foods, stress levels, to see if those may also be contributing to hot flashes. It is possible to be on hormone replacement and still get hot flashes if there's things in your environment that are causing those hot flashes to happen. Look at that. But there is no upper age limit for hormone replacement. So as long as you're on a proper dose and delivery method for you, if you're on bioidentical hormones and not synthetic, there's not a lot of side effects. So you can just make sure that someone's monitoring your levels at minimum once a year, just to see that you're still optimal. And that would be great. What do you think about bioidentical hormones for osteoporosis? I think it's amazing. Come on in. I'll cover this in a second. We got the prize patrol coming in. Come on, Paxton. So for those of you who have been here before, you know Paxton Sands, my son. He is our prize patrol. So he likes to come in on our Q&As and give away prizes.
I was a little late today.
Oh, that's okay, because we have plenty of questions. We were just talking. We were talking about some stuff you might not want to talk about.
I know.
My son knows about vaginas and all the parts, so it's all in our house. It's all normal, right? Yep. Awesome. All right. So today we're gonna give away a bottle of our Global that we were talking about.
You're weird now.
No, people don't think I'm weird. Everyone, these people understand. They get it. They get me and my weirdness. Okay, you want to get a give away the Glow Below? This is the one that everybody wants, I think. This is our Glow Below product that we were talking about earlier. So what do you want them to do in the chat, Paxton? Do you want them to say, write their favorite food, or tell us if they have a pet, or their favorite animal?
Kitten.
What do you want? Do you want to write chicken in the chat?
No.
Oh, what do they have to write?
What's a tay?
Oh, kitten. You want to write kitten? Okay, so Paxton likes cats. So anything that has to do with cats. See, she thought you said chicken. Any cats or kittens? Okay, perfect. So we're going to give you guys a second to get in there, and he is going to draw from or pick someone to win the Glow Below, and then he's also going to pick someone to win a copy of my book. That's going to be signed by me. It's going to come with our 21-day metabolic rehab program, which is online, and it comes with coaching, so it's awesome. All right, you can pick whenever you're ready. Oh, you picked someone? Who'd you pick? Oh, Essie, Essie, Essie. You wrote Kitten's Rule, and you are going to get a bottle of Glow Below. Now, if there's some reason why you don't want this, we will give you something else. Oh, my cat is named Beans, Sarah. So Sarah's going to win We have,
I'm not doing
all
it.
right, well, we're gonna give it to her anyway, and then she'll go pick another person too.
Okay.
Okay.
Tell Beans I said hi.
Okay, Sarah, you're gonna get a copy of my book and free entry to my 21-day metabolic rehab and hormone makeover. And then we're gonna pick one more. Another book and another 21-day metabolic rehab.
Tell Smokey I said hi.
Oh, that lady's name is Kat. Did you see that?
What?
She said her name is Kat. I don't know where it went. My kitten's name is that. You want that one?
No.
No.
Tell Gizmo I said hi.
I'll tell Gizmo you said hi. Okay.
Yeah. He knows the trick. Did he meow?
Okay, Melinda Montez, here, kitty. You are going to win a copy of my book and our 21-day metabolic rehab. So if you want anything, please email us at support@glownaturalwellness.com and we will give us your address and we're going to send your products to you and we will go ahead and get those out to you. Thank you, Paxton.
Bye.
Bye. All right, back to the question. So I think I was talking about osteoporosis. So what do I think about bioidentical hormones for osteoporosis? Well, the primary reason for osteoporosis, primary reason why we have bone loss is the loss of estrogen. However, there are other factors that can definitely help build bone back. Estrogen makes it easier. So bioidentical hormones make it easier, faster, more effective to build your bone back, but you can't just put the hormones on. You also need to put some stress against the bone. So resistance training doesn't have to be super heavy, but it does have to be challenging for you. So for one person who's very unconditioned and maybe hasn't worked out in a long time, doing body weight squats is going to be challenging for them and they're going to go to failure. They're going to get 20 and they're going to be sore and that is going to build their bone. Or for someone like me that goes to the gym all the time, I need to do weights. I need to do heavy weights that puts my muscles under stress. So walking is great. It is a weight bearing exercise, but really doing resistance training, either at bands with weights or something else is going to be super effective. And excuse me, I'm drinking a little water. And making sure that you're eating enough protein. Again, I always talk about enough protein. So 1 gram of protein per pound of ideal body weight is going to be what you need to build that bone. What do you think of a 65-year-old starting bioidentical treatment? Not too old. You can definitely do it. We have a lot of women 65, 70. That recommendation that you can't is really an old recommendation. And if you're getting the correct dosage and delivery method, I 100% recommend topical hormones as opposed to oral. You're going to be completely fine and it can be super helpful and really extend your quality of life, prevent you from having to go on pharmaceutical drugs for a lot of other things. I am a big fan. There is no upper age limit. We are living to 100, 110. So why would you want the next 45 years of your life to be miserable if you don't have to have them that way? Let's see. Hi, I'm 61 and I'm experiencing slight dripping after a bad cold that I have. Been in menopause for a year. I've done pelvic floor exercise for years. And I take cranberry capsules. I often have been treated, I also have been treated with the for UT. I use Replens for vaginal dryness, tried hormone supplements, pessaries, but after a while it started to burn. It could have been the additional ingredients in there. And every once in a while, women who have severe, whether it be irritation, tissue damage, loss of the skin barrier, sometimes when you start using a vaginal moisturizer or even a topical vaginal estrogen, there can be a little bit of like almost like if you've ever used a lip pumper or like it has like a little tingly feeling. It lasts about 5 minutes. That's not a bad thing. That's just showing you that it's working. And just if you ever get like a cut or a scrape and you have to put the like kind of like antibacterial ointment on it, that can burn a little bit just because the tissue is so compromised. but that will go away after a while. Sometimes you just kind of have to deal with it. But if it burns, then you can dilute it with some coconut oil or some olive oil to kind of make it feel a little better. But you can also alternate your vaginal estrogen or vaginal DHEA or whatever you are using. You can alternate that with something like a coconut oil or sunflower oil or something like that to kind of soothe, if that's helpful. Are you saying that someone at 70, that there can't be rejuvenation of the vaginal lining? No, I'm saying there absolutely can, but I'm saying that if you don't do anything about it, then it's going to keep carrying on. Yeah, absolutely. There's no age. The body is incredibly regenerative. If you think about if you get a paper cut in a week, the paper cut's gone and your skin is healed. So your body has that ability to do the healing. Your vaginal tissues, when they don't have the estrogen, they're compromised. The cells can't plump up. They can't kind of regenerate. They don't have what they need. So when you put the estrogen back, then they can do their regeneration and healing as well. So it doesn't matter what your age is. It matters like what you're doing. So just like if you let your lips get chapped, it doesn't matter if you're 80 years old, if you start moisturizing them and putting lip balm on and really taking care of them, they're going to be back to normal pretty soon. Let's see, I've been on L-thyroxine for low thyroid for many years. My free T3 is 2.8 and my reverse T3 is 9. Aren't those on the low end of normal? Yeah, under 2.9 on free T3 is on the lower end. But it depends how you feel. Definitely how you feel should come into play. I like to see above 3 on the free T3 for anyone who's having any symptoms like cold hands and feet, constipation, joint pain, feeling sluggish or tired, those types of things, hair loss, those types of things are indicators that you might need more. You might need closer to the higher end if you're having those symptoms. So you might ask your doctor who's prescribing for a little adjustment. The reverse T3 is fine at 9. Anything under 15 is fine. Could that be a cause for low estrogen? Depending on your age, if you are over at the perimenopause or postmenopause age, the cause for low estrogen, there's no mystery. It's that your ovaries stop making estrogen. Your ovaries stop producing. So it's normal to have low estrogen. When I said low estrogen, I mean low for optimal health. If you get a blood test or a saliva test or any test that's going to test your levels, there's going to be a range for menopause and then there's going to be a range for cycling. And so you will be, if you're in menopausal, you'll be in the menopause range, normal for menopause, which is pretty much non-existent levels of hormones. Also normal for menopause is all the things that we talked about today: hot flashes, night sweats, osteoporosis, brain fog, dementia. There's like 99. I have a handout of like 99 symptoms of menopause, everything from ringing in the ears to hair loss to nails are brittle. There are so many symptoms that are a result of the hormone decline. Did this just start? I logged in at the time listed, 6 p.m. EST. It seems as though this has been going on. No, you got in, you asked a question at 5:10 my time, and we started at 5 o'clock my time. And there's a replay, so don't worry about it. I talk fast, so yeah, 10 minutes is probably a lot of information. I grew up in New York, and I grew up in an Italian family, and you had to talk fast because someone would just interrupt you and you wouldn't be able to say what you wanted to say. So I am trying to work on, 1, talking faster, and 2, not laughing when I talk, because I know that sometimes it's hard to understand me. I do have a stuffy nose right now because my son went to a indoor trampoline park where they have like the trampolines, but then they also have like the foam pit. And he got sick last week, sore throat, congestion, and I thought I was going to be fine, but I got sick as well. So now I'm a little bit stuffy, a little bit congested. So that's why I kept coughing. But sometimes I feel like my voice sounds a little off. But don't worry, we're going to post the replay so you won't miss anything. Let's see, I've been experiencing painful intercourse and vaginal dryness for at least 6 years. I'm 72 years old. I didn't seek treatment because I felt there would be a risk of cancer with estrogen treatment. Is it too late for me to get? Absolutely not. You can definitely start something like Glow Below or a vaginal moisturizer, or you can go see your GP, and if you beg, they might recommend a prescription vaginal estrogen. And so it's absolutely not too late. There is no cancer risk with vaginal estrogen. So there's no increased risk of cancer. So you're definitely not too old. And yeah, I think it's very common. I'm putting can you guys put in the chat? Let me know if you're experiencing any of the symptoms of genitourinary syndrome of menopause. And then 2, if you shied away from getting treatment, if you didn't think you could get treatment, if you didn't talk to your doctor about it because it's embarrassing, or if you tried to get treatment and you didn't. So I'm just curious because the statistics of only 7% of women who try to get treatment get it is absolutely insane. When I read that, I was like, holy moly. That's why I had to do something about it. That's why I created that product. But yes, let's see. I had a Dutch test a few months ago. Is it possible to get a consultation? Yeah, so we do consultations at our practice. Just email support@glownaturalwellness.com and we can totally look at your test. One thing with the Dutch test though, it doesn't give you like the actual numbers of it doesn't even give you a progesterone reading at all, because it's measuring hormone metabolites, which are super valuable to see how your pathways are breaking down, but it's not actually measuring your total hormones. It's measuring what's coming out in the urine. It can be good if you're not on any hormones at all and using it for a first test. But if you're going to do if you're using topical hormones, then the Dutch test isn't a good way to measure topical hormones. But we do absolutely go look at consultations and all of that. Yeah, it looks like you did talk to your naturopath and you were given oral progesterone for sleep. Okay, depending on your age, that might be something we'd recommend, but we can totally look at it and let you know. If you're having a lot of other symptoms of menopause, perimenopause, then you might either need some help with your testosterone levels, your DHEA, or your estrogens possibly. And it's not just one size fits all. Some women just need a very tiny dose of estrogen. Women just need vaginal estrogen. Some women need very little or a lot more. Some people need a little bit of DHEA to bump up their testosterone. So it's really very individualized. Some women prefer to have the hormones a little lower. Some women prefer to have the hormones a little higher. There's no one way to do it. And so if you're wanting something different, chances are you know your body maybe a little better than your doctor knows your body. And so hopefully she's willing to have that conversation with you. And maybe you don't need any other hormones. Maybe you need some lifestyle stuff. So you may need some supplements or some changes to your diet or some stress reduction. I don't know you personally, so there might be some other things that you can be doing as well. How do you keep a perfect vaginal pH? You can't ever keep anything perfect. So there's no perfect in the human body, but to safeguard your vaginal pH, then you are going to want to do things like I recommended, so not use any scented products down there. Even when you're washing in the shower, shampoo, if you can use things free from dyes and perfumes, preferably organic, non-toxic products. You don't want to put any soap or douches or rinses up your vagina. So it's self-cleaning. It doesn't need anything but water. And underwear choices, breathable materials at night, maybe don't wear underwear to bed. If you just want to wear shorts or nothing, let it breathe. That's going to be helpful to help with your vaginal pH. After sex, urinate if possible. Eating a healthy diet, so probiotics and prebiotic foods, anti-inflammatory diet, avoiding lots of alcohol, lots of sugar. That is also important for your vaginal pH. And not wearing tight clothes all the time. So those are just a few things, making sure that you are not a chronic user of antibiotics or anything like that. All those things can be helpful, but you're never going to be perfect. Perfect is not what we're striving for. We're striving for balance, and we're striving for the best we can do. Let's see. So for the past couple of months, I've been having different color discharge. That can be for various reasons in perimenopause and menopause. If you notice a change in the discharge, if there's an odor involved and it's not the same odor that you're used to, that can be part of GSM, part of the genitourinary syndrome of menopause for sure. But it can also be from different things. So there could be an infection involved. You can go online. I don't have an article on this just yet, but you can look up the different types of discharge. If it's like cottage cheese-like and smelly, it could definitely be either STD or vaginal bacterial vaginosis. So there could be different things going on depending on the other symptoms that you're having. But go online and just look up vaginal discharge, different types. What does it mean? And you'll see there are different things. Now, some women in perimenopause and menopause have total vaginal dryness, and other women will have increased discharge. So it's not abnormal. It is just another manifestation of the syndrome. Do you offer hormone consultations for someone who wants to get their hormones balanced when they recently had lab results to review? We do offer a lab review. Oh, it's the same person. Okay. Yes. What do you recommend for a patient who has severe vaginal dryness and who has had estrogen, progesterone positive breast cancer? I would recommend a product like Glow Below because it's safe for breast cancer survivors and even people with current breast cancer. You can look at oncologists, North American Menopause Society, Institute of Health. They all have multiple studies and multiple papers showing that low dose vaginal estrogen does not go systemic to the body and does not increase any risk for breast cancer. And honestly, the newest research shows that even systemic bioidentical hormones do not increase the risk for breast cancer and actually reduce risk. But that's a whole other topic. I actually have a whole video on that. But yes, vaginal hormones are completely safe, and I would totally recommend a product like Glow Below if you can find one, or going to your doctor and getting a prescription. So far, this is the only non-prescription over-the-counter product you can get. And a couple people asked about the price. So this is a 3-month supply because you don't need a lot. And it's going to be $69 for a bottle, $20 a month, basically. It's very affordable. Let's see. My doctor suggested Vagifem. So Vagifem is just the estrogen. So it's just the estrogen. It's going to go into your vaginal canal. You might still want additional vulval moisturizers because that may not do the trick for moisturizing all the tissues in the vulval area, but that is actually great. It's going to give you the estrogen that you need to replace. I'm having bladder pain symptoms. Okay, interstitial cystitis. What do you suggest? Do you treat in your practice? Yeah, we do. It's a little more in depth than what I can answer here on the call. But yeah, we want to see what the root causes. We want to see, there's usually a multifactorial approach to treating that. So it's a little bit more than we got here. Do you go on full script to get a lubricant? You can. There's a brand called Good Clean Love that we like on there that has a few different personal lubricants. Yes. What's the best for bladder leaks? I hear the only thing is physio, like Kegels. So pelvic floor therapy is super awesome. Definitely something that you can definitely do, but something like a vaginal estrogen can help the pelvic floor muscles and the muscles of the vaginal vulva area to contract better, so you get more out of your physical therapy. Yeah, and so you had a full hysterectomy at 40, so you've been without your estrogen for a long time. And so that would probably be a really good thing for you to do, in addition to pelvic floor therapy. Is Glow Below, does it have estriol? Yes, it has estriol and estradiol. So it has 80 micrograms of estriol and 20 micrograms of estradiol. What about taking vaginal bioidentical hormones if you're being treated for hormone positive breast cancer? Again, it does not increase your risk for any complications for breast cancer. Of course, you can talk to your doctor if you're currently receiving treatment, just to make sure that they agree. If you're currently undergoing treatment for anything, it doesn't hurt just to let your doctor know what you're doing. But all the studies show that it's not going to increase your blood levels of estrogen. It's only going to stay local to the body. And most oncologists understand this. And so they do want to make you more comfortable while you're going through treatment. Can you use topical estrogen on the external genitalia if you've recovered from estrogen possible? Yes. So the whole vulval region, so the inner outer labia, the clitoris, the perineum, all that area. And even when you're putting it on, so you can just apply it with your fingertip. You can actually rub, like massage it into the area so it gets into all the tissues. Or if you're super shy, even with your body, you can put it on a tissue and you can just wipe. So either way you can do it, but depending on how much discomfort, how much irritation, how much degradation of the tissues, to get the best benefits, you're going to want to rub it in or get it into all the tissues. But yes, I totally recommend going from front to back, the entire region. How often would you use Glow daily or as needed? For the Glow below, the vaginal, it's a serum, so it's nice and kind of just really hydrating. It's not messy, so there's no like, nothing's going to come back out in your underwear, so it's not like messy or uncomfortable. It's actually really comfortable. So this product, we say for the first 30 days, use it daily. Some women might want to use it twice daily, depending on the severity of their condition. There's no, like twice daily is totally fine. You're not using too much. And then once 30 days has gone by, if you have some relief, you can move to like a 5-day-a-week maintenance dose. And so that will keep it going. Now we do have one coming out with DHEA that really does have to be used twice a day and will have to be used every day because of just the nature of how that hormone works. It doesn't really stay and it doesn't really do the same thing. But this product here is daily and then about 5 times a week as needed. But some women, they might want to use it daily as well because it's super hydrating and comfortable. Yeah, if you're looking for other people's questions, I'm doing it anonymously so that people's privacy, due to the nature of this conversation, I don't want anyone to feel uncomfortable that they asked a question and we know their name or we know who they are. And so I just, for the privacy of everybody, I'm not showing the questions. Let's see, I already have your topical estrogen, DHEA, and progesterone creams, which I can use on the vagina. Yes, exactly. Is there any advantage to using your new vaginal cream in addition? So the difference is the topical hormones that you're using are designed for like quick absorption, no kind of residue on the skin, so they get right into the tissue. And that's great for the hormone benefit of what you're doing even vaginally. However, they're not very moisturizing. They're not very soothing to the tissue. So this Glow Below is going to be more soothing, more hydrating, more protective for the protective barrier of the skin, more plumping because of the hyaluronic acid. So this design for the non-hormonal ingredients are just as important as the hormonal ingredients here. If you're using the hormone creams that you are using topically, vaginally, that's completely fine, and we do recommend it, but you're not going to get the additional soothing elements. So you will get all the benefits that I talked about for if you're using the estrogen and or the DHEA vaginally, you'll get all that stuff. So it will be helpful. But if you want the additional soothing, the additional, help with elasticity, kind of like, like your skincare, if you use the hyaluronic acid or, a different kind of active ingredients on your skin, it's the same thing I call it skincare for down there. It's like your little part of your routine now. What's your opinion on progesterone cream for women? I love it. I think it's great as just if you need it in the balance ratio with your estrogen. Progesterone cream is great. We recommend it all the time. I'm interested in purchasing. Okay, we will, when we send out the replay of this recording, I am hoping that we will have it available for purchase. I'm just adding one little thing to there. We have a little page set up where you can purchase it, but we wanted it to be something you can read and understand and make a decision. We don't want to just give you an order form. So between now and Monday, it will be available and you can purchase it. We only have 400 bottles right now, so I'm not pushing it too hard because we will sell out definitely, but then we have more coming. So we'll do like an official launch for it later. But I've been getting so much information, so much women talking to me about their inability to get help in this area and really their shyness to talk about these things. So because it's February and it's the month when we might want to be more intimate, or romance is in the air. And so many women are dreading their husband asking them for sex because it hurts or it's not comfortable or they're self-conscious. And that just kind of breaks my heart. And when I was in my 20s and I had ovarian failure diagnosis because my hormones were 0, I had all of these symptoms, you guys. Like, I had all of it. And I was a young girl and nobody told me anything about this. And so I feel your pain. I get it. I understand. Would you use glow as a lubricant for sex? If not, what would you recommend for that? So you could, we do. But the one issue is we're married, so we don't need to use condoms, but it is oil-based. So there is almond oil and sunflower oil here. And that is not recommended for latex condoms, but some different condoms you can use it with. So you can use it as a lubricant, or you can also use a water-based lubricant or a silicone-based lubricant as opposed to an oil-based lubricant if you're going to use condoms. And so there's the one by Good Clean Love, a brand called Good Clean Love, and there's another brand called Yes. Both of those brands are completely clean and non-toxic. Those are two that I like, but there's so many out there that are really good. I mentioned a couple before. I have another video on libido on my YouTube channel, and I think I mentioned a couple on there as well. I get a lot of UTIs, so estriol has helped me, but orgasms can bring them about, and I don't know why. And that's not using a partner either. Okay, that's my question. It could be the friction, possibly. Yeah, I don't know why orgasms would cause a UTI, but it could be just the rubbing motion, perhaps. I don't have an answer for that. Bless you, Dr. Michelle, for having this discussion. Of course, I don't have not a lot of things embarrass me as a doctor, right? Because it's if you are a interior designer and you're like looking under the dining room table and there's a different parts, like that's how it is for a doctor, right? So I don't see it as like embarrassing so much. And people laugh because I'll talk to my son about his penis or vagina, and like he doesn't think anything of it anymore. But then he'll be like, "Mom, there's people around. They're gonna think we're weird," you know. Anyways, oh my goodness, I'm 63 and I have not been able to have intercourse for 2 years. Bless your heart. My doctor finally put me on hormone therapy, and I've been on estrogen for 2 months. We tried having intercourse last weekend with lubricants. Still in pain now. Will estrogen fix this? Eventually it will help, but you likely need a vaginal estrogen in addition. There's 20% of women on systemic hormone replacement that also need that vaginal estrogen just because they need it directly delivered to those tissues. And you probably need a vaginal moisturizer on a daily basis. Something like Glow Below has both, but if you're working with a physician who will actually prescribe you vaginal estrogen, then you can also do a non-hormonal vaginal moisturizer, but just put it in your daily routine. I'm really trying to be an advocate for taking care of your vagina as you would your face, right? There's skin down there, there's tissues down there, there's really important tissues that affect how we move and how we interact. And we really do need to, we can't just ignore them. We can't just like let them do their thing and hope for the best. So yes, a vaginal moisturizer, something like Glow Below can help, something like vaginal estrogen plus a vaginal moisturizer. And you can be on systemic hormones, hormone replacement therapy, bioidentical hormone replacement therapy, and be on vaginal estrogen at the same time. Doesn't interfere, doesn't add to your hormone levels because it stays local to the vaginal and urinary tissues. My best friend shriveled externally and internally, green mucus, bad pain, went to Cleveland Clinic, no help. That's unfortunate. I'm so sorry to hear that. Hopefully she got some help by now. Can I get my orgasm back if I have clitoral atrophy? Yes, absolutely. So the atrophy, both of the vaginal walls and the clitoris, happen due to that lack of estrogen. It causes the tissues to shrink. They basically shrivel. So they get smaller. And the nerve endings that allow you to feel pleasure, those actually shrivel as well. So they go dormant. And some women will say they don't feel anything anymore. There's like, it's like they can feel something's happening, but there's no like arousal sensation. And that can definitely be helped with, usually you're going to need more than just the non-hormonal moisturizer. You're going to need the hormones. So you're going to definitely want to have estrogen vaginally for sure. And that will come back over time and it will be awesome. So definitely, it's very normal, you guys. It's not abnormal and it's not something that is unique to you, even though you don't hear about it a lot. I don't know that anyone else on YouTube is talking about this. There might be a few doctors out there talking about these issues, but it's very rare. And I don't know anyone who's doing Q&A on this topic because, no, who's going to do that? But I will, because I care. See, my mother is 83 and suffering from bladder infections constantly with E. coli, has been prescribed numerous antibiotics. Please let me know what I can do for her. So she will still have to do her antibiotic treatment, but definitely I would get her the glow below and have her start using that because that's going to help prevent those recurrent UTIs. It's going to protect her. It's going to really improve that barrier function of her skin, really protect the microbiome, and also make sure that she is taking some probiotics, that she's eating prebiotic and probiotic rich foods, that she's eating anti-inflammatory diet, that she's not wearing like really tight clothes or sitting in the same underwear for too long. Make sure she has good hygiene, all of that stuff. But definitely the vaginal estrogen can work wonders at any age, wonders at any age. What do you think of the Cooch ball that is used in conjunction with diaphragmatic breathing? That can be super helpful. So it's a great kind of resistance. It's almost like weights for your pelvic floor. We have a pelvic floor specialist in our practice. Her name is Jasmine. And in our Healthy Hormone Club, we actually have a Healthy Hormone Academy, which is a 12-week kind of like lifestyle to improve your hormone health and your overall female health. And she actually does one of the modules where she teaches all the different techniques that you can do at home for pelvic floor therapy. But she actually says you can do it with just your finger. Like you can actually just use your hand as resistance. And she has a technique to use. So you don't really need anything additional. But the Cooch ball it's kind of a funny name, but it's just a little rubber ball. You can use your kids' toys if you wanted to, get one for yourself though. That's weird. Yeah, it's just putting some resistance against the pelvic floor. What about testosterone? What is the optimal level for menopausal women? It's going to be about like between like 30 and 50 in that range for menopausal women. And that's like a saliva test. So it depends on which test you're taking. Do you recommend testosterone gel? We actually don't. Most women can get their level above the range with topical DHEA, which has multiple benefits for anti-aging and longevity, but also boosts up the testosterone because it's a precursor to testosterone and converts it about 50%. And it does so without the assault of the negative testosterone symptoms like the weight gain around the belly, the hair loss, the facial hair, acne, aggression, irritation, stuff like that. But most women are able to get to the higher level of, or even above the level. We don't put them above the level, but they can get there with topical DHEA. And so it's just like all the benefits, the side effects, and additional benefits for anti-aging with DHEA. So we usually use that in our practice. And also, just as a side note, testosterone is not FDA approved in the United States for use in women. So in our practice, due to the nature that we use telemedicine, we don't prescribe testosterone, but we do get our testosterone levels up to the optimal range. Are Kegels the only way to strengthen the pelvic floor? No, there's many other exercises. So sometimes Kegels are the opposite of what you need. So you definitely want to either work with a pelvic floor therapist, or I'll have Jasmine come on and do a Q&A with me and maybe do some demonstration. Dr. Jasmine, she's a doctor of physical therapy, pelvic floor specialist. She is amazing. And she works in our practice now. And like she has actually put together the pelvic floor module of our Healthy Hormone Academy. But I'll have her come on and do some either Q&A or even a Q&A with some training for you guys, because yeah, it's not just Kegels, it's not just the squeeze. There's other things that can be done, and there's other things that should be done for optimal pelvic floor health. But even things like doing a weighted squat, if you are, when you are, so if you, those of you who go to the gym or do squats, when you squat down, you're kind of like going down, but then when you're pushing back up, that's the hard part of the squat, where you're pushing the weight back up. If you imagine, so you kind of like pull your pelvic floor up. So imagine you're sucking like a thick smoothie through a straw through your vagina. So imagine that action. That's what you do when you're pushing back up. So doing squats like that with the whole mind-body connection, that will help your pelvic floor as well. So women who lift weights a lot of times don't have to do additional pelvic floor exercises because they are working the pelvic floor when they're doing their weight training. Yeah, you do not see Glow Below on our website because it's not available on our website yet. It will be available on Monday, likely, but we'll send a replay out to everyone here. You guys, I'm going to send a replay out tomorrow with a link to purchase it if you want to. So you'll be the first ones to purchase it or to know about it, basically, before we kind of send it out to everybody. So it's brand new, basically. I'm the opposite of like a marketer. I'm doing all these Q&As and telling you about vaginal health and vaginal dryness and GSM. And I don't have a whole sales funnel behind this. This is just really for your information. Oh, and by the way, I made this product, but you can't even buy it. So I'm not trying to sell you anything. I'm basically just trying to educate you. And you maybe will go to your doctor and get a prescription. And unfortunately, if you don't have like the right insurance, these prescriptions for vaginal estrogen could be $100 or more. Like I heard one woman say it was $300, which is ridiculous. I'm really not trying to sell you guys stuff. I'm just trying to educate you. But if you want to buy the Glow Below, we will have it available. We'll have a way for you to buy it tomorrow. Awesome. Let's see. I recently got my blood test that showed my estradiol was very low. I'm taking compounded hormone cream that contains estrone, estradiol, estriol, progesterone, pregnenolone, and testosterone. Why would the estradiol be so low? Is it important to take progesterone and estradiol in precise combination? It's important to have the right dosage of estradiol and progesterone. I usually don't replace estrogen because it doesn't have any real benefit. So I would just talk to your practitioner about your dose, talk to her about your testing, make sure that, let's see, what did you say? You got testing recently. Oh, I recently got a blood test and you're taking it looks like you're taking a topical. Are you taking a cream? Creams do not show up in blood tests. So the serum concentration of your hormones is not a measurement of the hormones that are getting in your tissues. When you're taking topical hormones, when you're using transdermal or topical, the hormones are going through your skin into your tissues. They're not circulating through your bloodstream. They do kind of move through your lymph and through your bloodstream, but the concentration doesn't stay high. And so oral hormones can be measured in blood, but topical hormones should be measured in either saliva or capillary blood, the blood that's in your capillaries, and that's done with a dry blood spot test or a finger prick test. So that's why your hormones are low. So I would go ahead and test properly with either saliva or dry blood spot and see where you're at, but also go off your symptoms. So if you're still having a lot of symptoms, then you might need increased dose. It looks like you said you have low bone density. If that hasn't improved after a year or two on bioidentical estrogen, then you might need a higher dose, but you might also have to add in the lifestyle, the strength training, the protein, all of those things. You're so welcome. And what about using hormone replacement and lichen sclerosis? Yes, so that is a very painful and uncomfortable condition. We have seen improvement with vaginal moisturizers, and it has to have certain things like cocoa butter, shea butter, and beeswax. Those particular ingredients are wonderful because they are very soothing and they protect that protective barrier. They restore that protective barrier, which can be very problematic. And then the topical estrogen can be helpful as well. There, you might need some additional treatment depending on the severity of your condition. There are specific medications and topical medications that are recommended. So that's kind of more of like a dermatological condition, but we have seen improvements with topical vaginal estrogen and emollient-rich botanicals as well. So I would definitely give it a shot, but also know that you might need further treatment depending on the situation. What type of progesterone do you recommend? Depends on the person. Bioidentical for sure, mostly bioidentical topical progesterone because there's no risk of clotting. What can I do to gain weight? Oh, I talked about that earlier. Looking at your diet, let's be more of a nutrition question. I think we're all typing questions in the chat. I'll go look at the chat in a second. I'm going to the Q&A first because those people followed the directions. No, if you have a question in the chat, put it in the Q&A if you can. And I'll probably just stay on for another like 20 minutes or so, but I can download the chat. So I will download the chat and I will make a video answering those questions. So, because I'm really dedicated to you guys to getting the questions answered, because this is stuff that you guys need to know the answers to. And 80% of doctors don't know these answers. 80% of the doctors that you guys are seeing, your primary care, your gynecologist, your endocrinologist, have zero training in perimenopause, menopause, or hormone replacement therapy. That's the truth. It's sad. You can go through entire medical school and not take one class, hear one thing about women's health in menopause. You can be a gynecologist, and never get any training in perimenopause or postmenopause because you're really a baby doctor. You're really a reproductive doctor, and your training ends when menopause starts because people used to die around that time. There are some newer, younger doctors who are getting some elective courses in menopause, perimenopause. There's the American Academy of Anti-Aging, which I am a part of, which has a lot of training for doctors on hormone replacement therapy, on menopause, but the doctors have to go to that after they complete school. And to be 100% honest, as a doctor, I know this, you have to pay for those, right? So we have to pay extra, we have to fly somewhere, and this is to get your continuing education credits. It's a lot easier when the pharmaceutical rep from whatever the most recent drug is, comes and they give you like a video to watch or a handout to read, and you can get continuing education credits that way. So that's what most doctors are doing. They're doing the bare minimum. But there are some really great doctors out there that are understanding this and are women's health specialists and do understand. So if you find one of those, hold them, but hold on to them and don't let them go. Yeah. Awesome. And then, you have the med spas too. So you have the doctors that don't know anything about hormones and hormone replacement. They'll be like, oh, hormones, those are bad for you. You shouldn't take hormones, those are bad. And then let me prescribe the birth control pill, which is synthetic hormones, which is bad for you. But so you got those. Then you have the opposite end of the spectrum. You have these med spas that are like clinics that do like Botox and fillers and facials. And now they do hormone replacement therapy, but they actually know nothing about hormones, but they're just giving everybody hormones, everybody at the same level, and usually very high levels of hormones. And people feel fine to begin with, but they end up getting issues down the road. And so you have those two ends of the spectrum, and then you have the people in the middle that are really great doctors that understand menopause, have gone for additional training on perimenopause, menopause, vaginal symptoms, hormone replacement therapy. But it's a very small percentage. And of those very small percentage, most of them are charging a ton of money. You have to be a celebrity or independently wealthy to afford their services. And so then we have doctors like me who are affordable, who care about you, who are trying to make things like the average person, because I feel like I'm the average person, and I don't understand why like the bus driver and the grandma and the lady that works at Starbucks shouldn't be able to feel awesome too. But you have to find that they're out there. You just have to find them, and you have to really like with anything in health, you have to really be your own advocate now. You have to do your own research and you have to fight for yourself and stick up for yourself. And if the doctor says something you don't like, you can find another doctor now. It's not like the old days where it was like one doctor in a town and you had to deal with it. Now, like there's many different options and you can do online telemedicine. So don't just settle for no answers. What do you recommend for sleep issues? I usually wake up at least 2 times a night, sometimes 3. Usually I can go back to sleep fairly easily. I received bioidentical pellets a couple of years ago, but due to the move, it discontinued. So there's a lot of questions here. I'm not a big fan of pellets because those are super high dose and what's called like a supraphysiological dose, which means it's higher than you should be. And so some people can feel great for a period of time, and it's okay if you're like in your early 30s and you take a super high dose. But what happens is it actually ends up backfiring and your body starts to make a lot of sex hormone binding globulin and resist it. And then your own hormones aren't able to get to where they need. And you end up having like withdrawal symptoms and negative symptoms. Because hormones are like Goldilocks and the 3 bears. You guys know that story. Too much is bad, too little is bad, just right is where you want to be. And that's what you have to think about with hormones. So I'm very much a fan of not giving levels that the body shouldn't have, because that's where the problems happen. That's where like things go wrong. That's where hormones start breaking down unhealthy pathways. Really want to keep people in the healthy levels. And let's see, for sleep, I mean, there's so many things you can do for sleep: nutrition, meditation. We have a supplement called Glow PM that has a lot of botanical herbs and it has melatonin. So those are great. Magnesium glycinate can be great for sleep. Turmeric can be great for sleep. CBD oil can be great for sleep. So there's a lot of great things for helping with sleep. So I'm not sure what you're doing so far. Definitely having a nighttime wind down routine, getting rid of the blue light, wearing like blue light blocking glasses if you're going to have any screens on, doing some wind down mentally, like a brain dump. If you have a lot on your mind, if you've got a lot going on, either with kids or school or dealing with parents or anything, just write down everything you need to do on a piece of paper so you're not like trying to like remember it and stressing out. Take some time just to do some deep breathing at night, sometimes a warm bath, keeping your temperature in your home low, like 67 to 69 degrees when you sleep is ideal. And then I do have a separate video on my YouTube channel, which I'll link below this on the replay, for libido and for sleep. So naturopathic solutions for sleep and solutions for low libido. So we can cover those on there. What do you suggest for hormones? Do you suggest all hormones are taken topically? Are there any BT orally in your practice? We actually only recommend topical hormones because of the lower risk factor and the ability for, they work really well. You can use, with topical hormones, you only need to use 1/5 of the amount that you use orally, because with orally, you lose so much to that liver metabolites and the digestive process. So in naturopathic medicine, we believe in like the lowest effective dose. We believe in doing no harm. So those are 2 of our principles. And so we're going to use the most natural. Usually we don't get our hormones through our mouth. It usually comes from inside the body tissues. So we're trying to mimic what the natural cascade is for hormones. And we don't want to give you excessive amount of hormones. We don't want hormones to be metabolized in unnatural ways. And that's all part of why we do topical hormones. Also, the safety profile is excellent. Bioidentical topical hormones have almost 0. I can even say they have no risk, no additional risk. And they actually have negative risk, meaning that women who take topical bioidentical hormones have less risk of lots of conditions like heart disease, dementia, diabetes, osteoporosis, cancer than women who don't. So that's why we use topical hormones exclusively in our practice. Can high blood pressure starting several years post-menopause be attributed to a big drop in estrogen? It could be. We have a guide, which I'll also link under the replay of this Q&A, is 99 symptoms, 1 root cause, and it's all of the symptoms of estrogen and progesterone dropping, and blood pressure can be one of them. Can BHRT help with stabilizing blood pressure? It can, but not, it's not a panacea. So it's not like, oh, you're just going to take hormones and your blood pressure is going to be magically fine. You're going to also have to do the lifestyle. You're also going to have to change the diet. You're also going to have to do things to help it along, but it can totally help. What are your thoughts on hormone pellets? I already talked about that. I'm not a big fan of pellets, but the only time that I would recommend pellets is that you absolutely, either you have dementia or you absolutely just cannot remember to be consistent with your creams, then go ahead and get a pellet, but please make sure that you go to a doctor who can customize your dose, who isn't overdosing you. The problem with pellets is once they're in, you can't adjust it. So you just have to wait for it to kind of die down. And also you get like a massive dose and then it kind of dwindles over time. So you kind of feel great, then you feel crappy. And then a lot of times you will have the negative symptoms of hormone excess. So it's just, most doctors who are well-trained in hormone replacement therapy don't recommend pellets. Pellets are really popular at the med spas where you don't really have to know anything. You just, everyone gets the same pellet. There's no testing. There's really nothing that you need to know except how to do that little incision and insert the pellet in. But you know what? I am a fan of what makes you feel good. If you're getting results, it's really about your personal choice. It's not about what I like or my opinion. It's about your opinion. So I do not look down on or vilify, or I would never say not to do something. If that's what you want to do and you do it and you feel great, then I totally support you. Just know that there might be some warning signs. It might not work the same way you want it to work forever, and be aware of the dangers of excess hormones being too high, some of the symptoms and side effects that might be happening. I don't know what bioidentical hormones are. Okay, bioidentical hormones are just hormones that are replacing the hormones that you no longer have in your body, either due to a hysterectomy, a surgery, or natural perimenopause and menopause. They are biologically identical to the hormones that your body makes. So basically, the chemical structure, how your body uses them, how your body recognizes them, is biologically identical to the hormones in your body. So if we're replacing hormones, you can replace hormones with synthetic hormones or pharmaceutical synthetics. They're kind of like the hormones in your body, but they're not exact. So your body knows that. Your body is very smart, and it metabolizes them a little bit different, uses them a little bit different. There's some side effects, kind of like birth control pills. They're not biologically identical. They have a form of estrogen, they have a form of progesterone, but it's not the estrogen or progesterone that your body makes. So that's the difference. Let's see. So we offer bioidentical topical hormones, and then you can also go to your local doctor, get a prescription for bioidentical hormones as well. Are they safe for someone with chronic kidney disease? Topical, yes. Oral, no. Another reason why we use topical, because a lot of times, especially, we are a virtual clinic, so we work with women all over the country, all over the world, and sometimes people don't tell us that they have certain conditions. And so we would always want to use the form of the hormone that's safe for the vast majority of people. Oh, I just answered it. It says, do you treat patients from afar? Yes, we treat patients all around the world. And our Global product, the vaginal moisturizer with the estrogen, that's available all around the world as well. So you don't even have to have an appointment with us. You don't have to have a test. You don't need anything. You just start using that to get relief, because again, it doesn't go systemic. So that's the beauty about it. It's inexpensive. You don't have to join any programs, buy any testing, buy any consultations. You don't have to go into a doctor. But one caveat that while I'm saying that, if you use something like Global, a vaginal estrogen and vaginal moisturizer, and you use it for a few months and your symptoms do not get better, you still have itching and burning, you still have pain, then you want to go make an appointment with a gynecologist. You want to get an exam just to make sure there's nothing else going on, because it should improve your condition. And if it doesn't, then you may have something else going on that needs attention. Or if you have any like massive abnormal bleeding or something weird that you think is really weird happening, go ahead and get an exam. I'm not saying don't do that, but 90% of women who experience the symptoms of genitourinary syndrome of menopause don't need to go into a doctor. A lot of times, even if you're at a doctor's office and they're not even going to do an exam, they're just going to, you can just describe the symptoms and they're like, okay, you need vaginal estrogen. So that's really how it's diagnosed, just from symptoms. You don't need to do a culture or anything like that. But if you are experiencing prolonged ongoing symptoms, even with treatment with a vaginal estrogen and vaginal moisturizers, then you still do want to get localized treatment. All right, you guys, let's see. So 6:42. I'll go for another like 10 to 15 minutes answering questions. See, I'm 56, postmenopausal, about 15 months, hot flashes, dry vagina, but also dry, itchy anus. I've been putting coconut oil on. That's great. That's helping. You likely want to get some vaginal estrogen too. That will be super helpful. You might want some systemic estrogen with the hot flashes. Again, it's hard to say because like conventional medicine will say hot flashes only last 5 to 7 years, but I've worked with thousands of women who are in their 50s, 60s, 70s, and 80s. And there are a lot of women who are in their 70s and 80s who are still having hot flashes, and they were told 20 years ago by their doctor that the hot flashes will only last 5 years. So like, okay, I'll just suffer through it and then it'll be over. But they also weren't told about all the other negative impacts of losing estrogen. It's not just about suffering through the symptoms. It's about preventing heart disease. It's about preventing dementia. And estrogen loss will shrink your brain and will actually contribute to amyloid plaques in your brain. So taking estrogen prevents that. So it's not just about sticking through, but so what I'm saying is you might want to do some systemic hormone replacement to help with the hot flashes, or you can start with vaginal estrogen, and that will help with the dry itchiness and the vaginal moisturizer as well. And then you can see if you can use some of the, like, eliminate some of the triggers for the hot flashes, things like caffeine, chocolate, alcohol, sugar, stress, and see if that does it for you. Also upping your omega-3s, optimizing your vitamin D. That alone might be able to help with your hot flashes. If it doesn't, then consider systemic hormone replacement. I was given DHEA cream vaginally. How does that compare with the estrogen cream? DHEA cream vaginally can be helpful as well. We actually have a version of Vulvo with DHEA that is coming out in the next couple of weeks, just for anyone who has like a stigma against estrogen, I should say. But the DHEA cream, the benefit to that is if you apply it before intercourse, it increases the pleasure stimulation because it has a little bit of like a sensitizing aspect to it. The main difference is it's not quite as hydrating. It's not quite as helpful with the elasticity. It's not quite as beneficial because the DHEA we're trying to get to convert to estrogen in the vaginal tissues in order for it to do its job. There is some help, testosterone receptors in the vagina as well. So there definitely is benefit. It's just not quite as beneficial. And the other thing is you need to apply it once or twice a day ongoing, as opposed to having the maintenance where you'd only need it every 5 days or every 4 to 5 days ongoing for the estrogen. So they're both great. It's a matter of preference. If you're getting results from that, I would keep going. Awesome. And then HRT for 17 years and get cold flashes when I need to change my patch. How do you interpret this? You know, we all talk about hot flashes, but really what it is, vasomotor symptoms or temperature regulation symptoms. So your cold flash is the same as a hot flash. And so when you need to change your patch, it just means that your hormones are getting too low. And you need that influx of the hormones again, and you're having that temperature regulation issue still there. So it's nothing weird or anything like that. If the cream is so low dose, does it really supply the needed amount of estrogen to correct a deficiency? So the needed amount of estrogen for your vaginal tissues is very low. The needed amount for those tissues to absorb is very small, but that small amount does a big deal. It's not high enough to go systemically through your entire body and make those changes. That requires like 100 times higher dose than what we put in the vaginal cream, but it's super effective. Study after study has shown that the dose, even half the dose that we put into Vulvo, even 10 micrograms of estradiol, is proven effective for vaginal atrophy. Yeah, it's just science. But yeah, super low dose and super effective for the vaginal tissues. Let's see. If your TPO is at 12, is that Hashimoto's? Usually not. Usually thyroid peroxide antibodies. 12, I would just keep monitoring and make sure it doesn't go up, but 12 is pretty low, usually not an issue. Let's see. I suffered from menopausal symptoms for nearly 2 decades following a total hysterectomy due to having breast cancer and was told not to use hormone replacement. Know why? It's because 20 years ago, that's when the Women's Health Initiative study came out where they studied Premarin and plus synthetic progestin. And so those 2 hormones were the most prescribed, oral coarse estrogen and oral synthetic progestin. And those did have issues. Those were not good, contraindicated for most women, especially women who have cancer, because they are shown to cause some issues with cancer, especially the progestin. However, when they did a reanalysis that study 10 years later, they actually found that the group that took the coarse estrogen, the Premarin, the oral coarse estrogen, which we don't recommend at all, but that group actually had a decreased risk of cancer. And now we know the studies that women who have been pregnant more times, women who have had higher estrogen levels of estrogen throughout their life have lower incidence of cancer, and women who are on bioidentical hormone replacement have lower incidence of breast cancer. And if they should get breast cancer, just they were going to get it anyway, because cancer takes like 10, 20 years to actually develop in the body, they actually have better outcomes. So it's easier for their body to fight the cancer because estrogen is actually cancer protective. It's synthetic hormones and top oral synthetic progestin, specifically medroxyprogesterone acetate, which was a major problem in those studies. So that's why you're being told that you definitely can start on bioidentical hormones. Topically is what I'd recommend. That has the least risk profile, and you absolutely can do vaginal estrogen or vaginal DHA for that matter. But yes, the information is out there now. A really great book, if you want to read, is Estrogen Matters, written by an oncologist. And it really debunks a lot of the myths and fears around estrogen. And then there's also a really awesome researcher. She's a doctor out of Austin, Texas. Her name is Dr. Berkson. And she wrote a paper called Estrogen Vindication. And she is a breast cancer survivor herself. And she has some really compelling information. She was at the symposium where they actually reevaluated all of the studies from the Women's Health Initiative, and there was all the prestigious cancer research universities were there, and they actually all agreed that hormone replacement therapy does actually not cause cancer when you use the correct hormones in the correct dose. So anyway, I have a whole nother video on that as well. Okay, let's see. I have atypical ductal hyperplasia, precancerous cells found in my breast, and osteoporosis. My doctor wants me off estrogen patches, but once I did, I had sleep issues, dry skin, bone loss. Since I don't have cancer, can I still continue bioidentical hormones? So I can't legally tell you to not do what your doctor says, but I can tell you that in general, yes, even if you have precancerous cells, I'll say this. If I had your situation, I would absolutely be on bioidentical hormone replacement because of what I just said earlier. If I were to get cancer, I have a much higher rate of survival and much easier way to fight the cancer. So I can't tell you what to do, but I can tell you what I would do in that situation. So hopefully you can read between the lines. Let's see. I've been in menopause for at least 2 years. I feel like something's wrong with me because I never had night sweats. No, you thank the heavens that you've never had night sweats. Not everybody has the same symptoms. So I've never had night sweats or hot flashes or anything other than my period has stopped. What can I do to prevent these other symptoms? So everybody has a different, just like we're all different, everybody has different experiences. So you might have some of the other symptoms, joint pain, dry skin, hair loss, weight gain, trouble sleeping, irritability, brain fog, vaginal issues, right? So you may have some of those and not the hot flashes and night sweats. I know a lot of women that actually don't have the hot flashes and night sweats. It's common, but it's not everybody. So yeah, if you have the other symptoms, then you could still do hormone replacement therapy. You can do systemic, but if most of your symptoms are vaginal, then you can just go with the vaginal. If most of your symptoms are kind of brain related, mood related, hair, skin, nails, that kind of stuff, if you just want to prevent things like heart disease, osteoporosis, Alzheimer's, dementia, if you just want to kind of be optimal, then you can be on low dose bioidentical hormones just to kind of keep you in the healthy range, but not super high. And that can just like help you with longevity if that's what you're looking for. But do what's right for you. What do you think of the product Lume created by Gino? I don't know a ton about it. I know it's kind of, is that the deodorant Lume? I think so. I'm not sure. Or is Lume, or maybe it's Lume. I'm calling it Lume. I don't even know. I'm not sure if it's the deodorant or if it's the breath metabolism thing. I can't remember, but I don't know. I'm not sure. If it's the deodorant, it's really cool. If it's the breath thing, I have questions on whether it's actually accurate, but I haven't done a ton of research, so I really shouldn't say anything. I don't like to comment on things that I haven't done all the research on, because I like to be educated about what I talk about, and I can't say either way on that product. See, I had a hysterectomy 20 years ago. I have vaginal dryness. I've tried vaginal estrogen creams and testosterone creams, but I have side effects, very tender breasts, significant hair loss. What do you recommend? So if you were using the proper dose of the vaginal creams, you shouldn't have had any side effects. So I would go back to, if you are still working with that doctor, maybe work with a new doctor, and if you're using testosterone cream, like topically, it could have been too harsh and strong for you. So I would go with probably female hormone replacement, which is like, mostly you start with estrogen, progesterone, and then you can add in any DHEA or testosterone if you need to top it off. But definitely make sure you're testing. You want to make sure that you know your starting level, and you know what dose that you need, and you only get the dose that you need, and then you retest at about 3 months, 4 months, so you can see where your levels are, and you might need to adjust those hormones down. You might need to adjust them up. I can have 2 women, 140 pounds each, same lifestyle, exercise the same, live in the same climate, same everything. And I can give one a specific dose of hormones, and I can give the other the same dose of hormones. And one woman will feel amazing. Her hormone levels will be perfect. The other woman, maybe her hormone levels are too high, because we didn't start with a baseline, so we didn't know what she currently had. And everyone absorbs and metabolizes and uses the hormones a little bit differently. So really, it has to be individual. It can't be one size fit all. The body deodorant, I think it's great. It's non-toxic. I love their advertising. They're completely funny, totally my style. I think it's perfect. Let's see, I forgot to include my question. Is my dry anus due to parasites or menopause? That I don't know. It could be parasites. It could be just the moisture issue. It could be several different things. So with lots of estrogen, you can have dry eyes, dry skin, dry scalp, dry vagina, dry anus. I mean, so it is a hydrating hormone. So that could be it. But also, if you have itchiness, it could be parasites or some other infection going on, or it could be some type of dermatitis too. Awesome. I'm almost 59, so I started menopause later. That's awesome, because you actually have more time with your hormones. So you're pushing back all of the diseases of low hormones. So that's actually great. I had a woman come to me this week, and her doctor told her that going into menopause later put her at risk for all these health conditions. Actually, quite the opposite. Going to menopause later actually provides you with more years with your healthy hormone levels. So you actually have lower risk of osteoporosis, lower risk of heart disease, because you're pushing it back. It's the same thing as if someone was on hormone replacement for those years. That's great. I think it's awesome. Let's see, my naturopath started me on oral prometrium. I also have low estrogen. She said the body can make estrogen from progesterone. your doctor needs to go back to school. So the cascade of hormones, you can like just Google a diagram, hormone cascade. Your body doesn't make really estrogen from progesterone. I mean, it's often the same raw materials of which is cholesterol, but DHEA breaks down to testosterone, and then testosterone can convert to estrogen. Progesterone doesn't convert to estrogen. That is not a good strategy at all. So go back to her and say, hey, what are you talking about? And why does she not just prescribe you the correct amount of progesterone that you need and then the correct amount of estrogen? It doesn't make any sense. Let's see. I have a severe osteoporosis after hysterectomy 11 years ago. Would you suggest rowing? I have bone pain at times. So rowing is good. Yeah. I mean, because you're sitting, I would say don't have that as your only exercise, because you want to also, because that's working your bones and muscles up top, but you also want some leg activity. Oh no, rowing does work your legs too. I'm wrong. Because yeah, rowing's great. You can totally do rowing. And then also just make sure you're getting plenty of protein, and that would be great. Hi, Jane. Okay, let's see. Oh, I don't want to say your name, but that's a common name. That's all right. I have fibroids, severe vaginal atrophy. What should I do? All the things that we're talking about. Fibroids are majority of fibroids are caused by environmental toxins and xenoestrogens. Making sure you have good detox. Fibroids can also be broken down with castor oil packs, which help kind of dissipate the fibroids, soften it up, and then help with the lymphatic drainage, which is where the toxins leave the body. So castor oil packs can be great for the fibroids. Reducing any toxin exposure is going to be great. And then the atrophy, I would totally recommend vaginal estrogen. That's going to be a great way to reverse that atrophy. Okay, let's see. 61-year-old headaches at 4 or 5 a.m. Recently starting with Vagifem. Some relief from headaches, now getting worse again. Could be dehydration. Overnight, we lose a lot of moisture through our breathing. Make sure you're hydrated, maybe taking electrolytes. There is a great, really clean electrolyte replacement drink that you can get. It's called LMNT, like elements, but LMNT. They make, it's like sodium, potassium, magnesium, so electrolytes. And they make this hot chocolate one that's so good. So you can drink that at night, and then you'll have more of your hydration if that's what it's from. Or you can just take magnesium. That might be helpful as well. I would probably need to know more about you in order to know what those headaches are coming from. It could be EMFs, it could be mold exposure, so many different things. If hormones change throughout the day, how accurate would the hormone test be at the time that you take it? We usually have like a time that we tell people to take it. So if we're doing a saliva test, we have them do it like at a certain hour of the day. So we kind of can compare apples to apples. But yeah, it depends also on your age and stuff like that. So if you're in menopause, your hormones aren't changing that much throughout the day, at least your estrogen and progesterone aren't. Your thyroid can definitely change throughout the day. So we usually recommend doing that test in the morning. And then other hormones like hunger hormones, insulin, that's going to be different. So we might have to do a fasted test versus a postprandial. So there's all different types of hormones. On long-term hormone replacement, is annual mammogram necessary? Not in my book. I'm actually not a fan of mammograms at all. That would be a topic for a whole nother video. But yeah, because if you are on long-term synthetic hormone replacement, then yes, I would say you need to get a mammogram, and you should probably be on it as short of time as possible. But if you're on topical bioidentical hormones, you're not increasing your risk at all. There's no additional need for a mammogram. Yeah, it's a lot of radiation, and mammograms, I won't get into it on this video, but there's a lot of negative issues with them that create a lot of stress and a lot of unnecessary surgeries. Yeah, I say no, you do not. Annual mammograms are not necessary in my book if you're on the correct dose and the correct delivery method and the correct type of hormones. How do you get vaginal pH back to normal levels? Through lifestyle, making sure you're using products that are supporting of the vaginal pH, getting your microbiome in order, and, using products, like I said, that are helpful. 63, looking for a way to help with alopecia. I have a great video on hair loss, all the different reasons and some solutions. So I will post the link to that in the replay, but you can go on my YouTube. It's Fix Hormones with Dr. Michelle. I've been referencing some other videos. So if you guys are hanging out this weekend and you want to get even more Dr. Michelle, you can watch some of those YouTube videos. And if you comment below any of my YouTube videos, I will read every single comment and I usually will reply. Let's see, I signed up for a GI map. So it should tell me that. Dr. Jade Davidson, truth about cancer, mentioned this could be parasite. Yeah, it totally could be. So I would say the GI map will tell you quite a lot and let you know what's going on in your whole GI tract, and that can help you rule things out. But it also can be like a dermatitis. It can be due to laundry detergent, or if you're wearing thong underwear, or if you are wearing like yoga pants all day, or it could be from the changes to the humidity or your soap. So there's so many different possibilities. I'd kind of be like one of those like fortune tellers at the carnival if I like told you exactly what it was. But those are just some things to think about. I'm afraid of estrogen because my mom had breast cancer 2 times and they said it was estrogen based. So you need to read Estrogen Matters, because here's the thinking. So if estrogen caused breast cancer, then every 22-year-old girl whose estrogen is at their height would be having breast cancer left and right. But who gets breast cancer? Not women who are at the height of their high hormone levels, not pregnant women whose hormone levels are like 100 times the normal level. It's women who are in the state of hormone decline. Those are the ones that are getting cancer. It's not due to the hormones. It's due to all the xenoestrogens. It's due to all the toxins, and it's due to how your hormones break down. Cancer is caused by stem cells, not by estrogen cells. There's actually no reason to be afraid of estrogen. Estrogen is so important for female health. But I do understand the stigma, because in 2002, there was a Women's Health Initiative study where it studied the Premarin, the pregnant mare urine-derived estrogen, and the medroxyprogesterone acetate, which was a synthetic progestin, both oral, those were prescribed at the time. And all this information came out about increased risk, cancer. And what they didn't do is control the study for who was in the study. A lot of these women already had high risk factors for cancer. The biggest risk factors for cancer are going to be being obese and sedentary, eating an inflammatory diet, and exposure to toxins. So they didn't look at whether these women were already sick or were already obese or had exposure to toxins or were living a healthy lifestyle. And in the meta-analysis that followed, the reanalysis of that study, it was actually shown that estrogen replacement, even the horse estrogen, even the oral horse estrogen, actually reduced the rate of cancer. It was the medroxyprogesterone acetate, the fake progestin, that was the culprit. And there's absolutely no reason to be nervous, but definitely look up the book Estrogen Matters. It's written by an oncologist, which is a cancer doctor. It's well researched. And then also look at Lindsay Berkson and her paper that she's written that's been published called Estrogen Vindication. Both of those are so good. I do have a video on my YouTube channel at Fix Hormones with Dr. Michelle that talks about does estrogen cause cancer, but it's short. And these books and resources, they're so good just to kind of counteract the media propaganda that has been kind of like carried on. And in medicine, there's something called translational medicine. And what that is the research that comes out today takes about 17 years to get to your doctor's office. It takes 17 years of us knowing the research for your conventional medicine doctor to actually start implementing that in their practice. So we're just about there where doctors should start realizing that estrogen is not bad. But the funny thing is, the birth control pill, which is synthetic estrogen and synthetic progesterone, is more close to the hormones in the Women's Health Initiative study than menopause hormone replacement therapy is. And birth control pills are handed out like candy all the time to so many women. So I don't understand why that parallel was not drawn, but the hormone replacement parallel was drawn. It's because there was a study on hormone replacement. But anyway, I hope that makes sense, but definitely get those resources. I'm not here to like try to convince you otherwise, but I do really feel like it's a huge disservice to women for them not to have the correct information. When I talk about oral hormones, I mean hormones that you swallow. Sublingual, those are okay. The idea behind sublingual is that similar to topical, they're going to get into the tissues and in the bloodstream and bypass the digestive process. The problem is most people swallow most of them because it's just the nature. They usually are in like what's called a troche, which is like a waxy kind of like substance that has the hormone inside. And they usually take 10 to 15 minutes to dissolve. So you have to hold them in your mouth for that long. And I can guarantee you're swallowing during that time. A lot of it is you're getting the oral action, but in general, they're okay. So could you use topical estrogen if you recover from estrogen, progesterone, breast cancer? You can. Let's see. If not, what do you recommend for vaginal dryness? Well, for vaginal dryness, if those are your main conditions, I would go to topical or the vaginal estrogen and the vaginal moisturizer, something like Glow Below or prescription vaginal estrogen. Those are both going to help those symptoms, the atrophy, the dryness, all of that, pain with sex, all of that. So those are great. Concentrations, 10 micrograms, 20 micrograms of estradiol, good to go. A lot of the prescription vaginal estrogens don't have any estradiol in them. I put it in mine because it's going to actually help even more with the moisture and help with, overall being most like what the body created. But a lot of times the pharmaceuticals only have like one hormone in them. Is it okay to use topical bioidentical hormones if you have genital herpes? It is okay, but it's not going to prevent the flare-ups from happening. So I'm afraid of any treatment with estrogen and my periods stop at 48 years old. Okay. And there is other treatments available. You can use non-hormonal treatments. I talked a little bit about the fear, so maybe I would recommend getting those books just so you have that information for yourself. Okay. I'm going to go ahead and I know there's more questions and I will download. We have a lot of women on here. So I am going to have to go because I have to make dinner for my son. Poor Paxton's probably starving. But just as a recap, I know a lot of you are asking about the Glow Below and you want to buy it right this minute. We will send out a replay. If you're on my email list at Glow Natural Wellness, we will send out a replay tomorrow with a link. If you're not on my email list and you're just on social media and you just found this because your friend told you, hey, watch this, I'm going to post this to my YouTube tomorrow, Fix Hormones with Dr. Michelle. In both cases, we will have the link to at least a basic info page on the Glow Below with a link where you can purchase it. And we'll also have some additional information, the things I talked about today. Additionally, you can email us at support@glownaturalwellness.com. That goes to my clinic. Full disclosure, we do not make our employees work on Sunday. So if you email tomorrow or today, give us a leeway till Monday to get back to you. But you can email support and just ask for the link and we'll have that ready for you this weekend. So I do have a couple girls that work on the weekend. Sometimes even my husband, Jeff, who's the CEO of our company, sometimes he'll answer questions too. If it's like billing related or payment related or order related, like he was not going to answer your questions about your vaginal dryness. My hormone specialist will do that and myself. Our website is glownaturalwellness.com. There's lots of great information there. My YouTube is Fix Hormones with Dr. Michelle. Also a lot of information there. And if anything else, also you can follow me on social. We do these Q&As. I try to do them every couple of weeks unless I'm traveling. So there will be another one in a couple of weeks. I'll alternate between Friday and Saturday doing the Q&As. Some people don't like them on the weekends because they're busy with their family. Other people can't do them during the week because they work. So I try to alternate. And if you have a topic that you want me to cover, definitely let me know either on Instagram. You can DM me or you can post. We have a Facebook group that is the Glow Tribe. where you can come in there and chat and give me ideas for videos or ask questions, and all that's free. So there's lots of ways to continue to the conversation with me. And I truly am here to help. I try to be as honest as I can and provide as much resources as possible without pushing anybody into anything. Like I said, we also, if you go to our website, glownaturalwellness.com, you look around, when you go to leave, there'll be a pop-up and it'll have a picture of this book. You can get it absolutely free if you just enter an email to let us know where to send it. We're not going to sell you anything. And this book is all the non-hormonal lifestyle practices to help with your hormones. There's a quiz in the front that helps you understand which hormone might be causing issues for you if you're not sure. And then there's a complete meal plan in the back to help with hormone balance, metabolism, all those things. So I try to provide as many free resources as possible. Anyway, I'm going to end it here. If you guys need anything, let me know. Let's see. Oh, yes. Celestina, answer to your question, yes. Email us. You're in my program, so email us at Support of the Natural Wellness. Put Healthy Hormone Club member in the subject line. That way we know you're in our program, and give me that information as well. And yes, we will honor that. Okay, awesome, you guys. Any questions, let me know. And I hope to see you on all my socials. I hope to see you on YouTube. And I will chat with you guys soon. I'll see you on the next Q&A. Bye-bye.